Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Osteoporosis is a common health concern, especially as we age. It makes bones weak and brittle. This weakening happens gradually. In osteoporosis, bones become porous and fragile, thereby making them vulnerable to fractures. It's often called a silent disease. Many don't realize they have it until a bone breaks. Several factors contribute to the development of this condition. Age is a major risk factor, as our bones naturally lose density as we grow older. This process accelerates after the age of 50, particularly in women after menopause, due to decreased estrogen levels. Hormonal imbalances beyond age-related decline can also contribute to weaker bones. Conditions affecting hormone production, such as thyroid disorders, can increase the risk of osteoporosis. Similarly, nutritional deficiencies play a significant role. Calcium and vitamin D are essential for bone health, and inadequate intake weakens the skeletal structure. Furthermore, a sedentary lifestyle can exacerbate bone loss, and lack of exercise can accelerate bone weakening. While physical activity, especially weight-bearing exercises, stimulates bone growth and strengthens them. Family history is a crucial factor. If osteoporosis runs in your family, your risk of developing it is significantly higher. This highlights the importance of early prevention strategies if you have a family history of the condition. Osteoporosis often remains undetected until a fracture occurs. However, some subtle signs and symptoms can indicate weakened bones. One of the most noticeable signs is a loss of height. As bones in the spine become weaker, they may compress, leading to a gradual decrease in height. Back pain, particularly in the lower back, is another common symptom. This pain often stems from compression fractures in the vertebrae, the small bones that make up the spine. These fractures can occur spontaneously or from minor stresses on the weakened bones. Another visible sign is a stooped posture or a rounding of the upper back, often referred to as a dowager's hump. This occurs due to the weakening and compression of the vertebrae, causing a noticeable curvature in the upper spine. Fractures are a major warning sign of osteoporosis. While fractures can happen to anyone, those with osteoporosis experience them more easily and from less force than someone with healthy bones. These fractures most commonly occur in the hip, spine, and wrist. Diagnosing osteoporosis involves a combination of medical history review, physical examination, and specific tests to assess bone density. Doctors will inquire about any risk factors, such as family history, lifestyle habits, and any previous fractures. They will also assess posture and check for any height loss. The most reliable method for diagnosing osteoporosis is a bone density test, also known as a DEXA scan. This painless and non-invasive procedure uses low-dose X-rays to measure bone mineral density, primarily in the hip and spine. The results help determine bone strength and the risk of future fractures. Besides DEXA scans, doctors may use X-rays to identify existing fractures or assess bone health. While X-rays cannot diagnose osteoporosis before a fracture, they can reveal bone thinning and structural changes. Also, blood tests can rule out other conditions that might contribute to bone loss, such as thyroid disorders or vitamin deficiencies. Early diagnosis is crucial for effective management. While some factors like age and genetics are out of our control, there are several steps you can take to reduce your risk of osteoporosis. Eat a bone-healthy diet. Ensure sufficient calcium intake. 1000 Lingard for most adults, 200 mg for women over 50 and men over 70. Vitamin D is essential for calcium absorption. Aim for 600-800 IU of vitamin D daily and try to get some sun exposure. Exercise regularly. Weight-bearing and resistance exercises, such as walking, jogging, dancing, and lifting weights, can help maintain bone density. Excessive alcohol and caffeine can contribute to bone loss. Limit alcohol and caffeine. Smoking accelerates bone loss, so quitting can help reduce your risk of osteoporosis. Treatment of osteoporosis involves the use of medications like bisphosphonates. These medications slow down bone loss and can increase bone density. Hormone replacement therapy, HRT, for postmenopausal women can help balance hormone levels and prevent bone loss. Selective estrogen receptor modulators serums mimic estrogen's positive effects on bones without some of the risks of HRT. Denosumab is a medication that helps prevent bone breakdown by inhibiting certain cells involved in bone resorption. Teriparatide, a form of parathyroid hormone, helps stimulate bone formation. Also, regular exercise and a diet rich in calcium and vitamin D are important components of managing osteoporosis. Fall prevention strategies, such as removing hazards at home, can also help avoid fractures. Living with osteoporosis requires making certain lifestyle adjustments to help maintain bone health. Taking steps to prevent falls, such as using assistive devices like canes or walkers, can help reduce the risk of fractures. Bone strengthening exercises promote bone health and can help manage osteoporosis. Thanks for watching.